It's going to dehydrate. Christina, do you want some water?
Somebody sedate me!
I'm Dr. A GP based in the UK, and that was an extreme example of the effects of restless leg syndrome. Now, the symptoms of restless legs can vary from a mild annoyance all the way up to depression, anxiety, and lack of sleep. And it's very tricky to diagnose, but these are the criteria you must meet to get diagnosed with it. The first diagnosis point is fairly obvious, but it's an uncontrollable urge to move your legs that may be associated with unpleasant feelings such as pins and needles, a feeling of shooting pains down your legs. Now, number two, the symptoms are far worse when you're at rest or laying down. Number three, your symptoms are partially or completely better when you start moving or walking. Number four, your symptoms are far worse at night. Number five is a bit of a complex one, and restless leg syndrome is a bit of a diagnosis of exclusion, which means no other cause can be found on blood tests or physical examination or in your history. We don't fully understand the causes of restless legs, but some things we know make it worse or can potentially cause it are being low in iron, low in B12, pregnancy, or some medications, in particular antipsychotics or antidepressant meds. Now, the treatment again is tricky, but if we know the cause or if there's an underlying cause for your restless legs, that obviously has to be addressed. Now, if you've addressed all the underlying causes and the symptoms are severe enough, we can give medication, but this medication has nasty side effects and it shouldn't really be taken long term, but is an option if you've tried everything else and nothing else is working.